thing, these devices here are called hydraulic lifts. Okay, so this is an example of a patient mover hydraulic lift. And more we want to see the employment of this equipment in a hospital because we as nurses don't want to lift. We don't want to injure our back because remember, we're not doing this once a day. We're doing this with every patient twice a day. So if you're doing it with every patient twice a day who weighs around 175 pounds, let's see, and you're working at 12, that's 6 times 4 patients is 24 times 175 pounds. If you round it to 200, see how much weight you're lifting in a day? See what's an issue? So this is a hydraulic lift. It comes with a series of, and we just checked yesterday to see if the electricity worked, but of course it does not. But it comes with a series of vests that we could use with our patients. Or slings, pardon me, slings. So one thing I could do is I could turn the patient, bend this leg, have them reach, or if they couldn't do that, I could use the lift sheet. I could go, I'm going to bend your leg, because half your body weight's down here, and half your body weight's up here. So if you bend their legs, it gives you a chance. And if they couldn't do it, I could have Derek grab the draw sheet. Okay, over here. You're going to pull it towards you. She's going to turn towards you.
The one that she
has.
has.
Yeah, that one. Pull her towards you.
All right. And so he could do that, because he wouldn't run and grab her. All right, and could hold her like that. Now maybe she could stay over there if she would for us and so on. But it gives him a handle on this patient. And then if I had to inspect her back, listen to her lungs, check her for sacral edema, see why her dressing's falling off, what you would do is put your hand on their shoulder, on their greater trochanter, just like that, and not this.
Oh.
Yeah, you're using the flat of your hands, because it's that where you're going to potentially injure. So let's say he was assisting me, and I'm either changing the bed or whatever, and go, hey, Derek, I want to listen to their lungs. I could be doing my, auscultation. All right, I could be checking for skin breakdown. I could be looking for excoriation, heals. The other thing I could do is, while I'm here, is where do bed-bound people... Now, where am I getting my edema? If I'm getting edema right now, where would it be?
On your leg.
In my lower extremities, right? Because I'm standing. But where do bed-bound people get it?
On their back and the butt.
They get it in their sacrum. So the other thing I could do while she's up here is I could press right here, trying to see if I saw 1, 2, 3, 4 plus pitting edema. We're going to cover up for privacy's sake. So this particular sling, this is the head. This particular sling, a way we could use it is we do something with all things we place under a patient called fan folding. So we put half of it up to where we want it, all right, and then we fold it like a fan, and we make it easy to pull out on the other side. Okay, so Mrs. Newman, there's going to be a little bit of covers to roll back over. Can you come back over towards me? Great. And I put down her leg, and I put up her leg. And I'm going to put the rail up first before we head this way, because nothing worse than having them roll out on you, and there you are. Okay, great. I'm going to have you reach for the rail if you don't mind. And I could use this. All right, and now he can adjust that. Okay, and then when we have her lie back against here, and we sneak her, well, I'm just making a mess everywhere I go. Okay, get her situated in the sling. All of these belts hook on these, all right, and then there's, I'm sorry, I know yesterday because I tried desperately to make it work. When I press this, she would come up in the air, all right? And this has, yeah. I thought you said professor. And so this has different levels because it depends on whether you want them lying flat or in some kind of sitting position when they actually come off the bed. So here's my safety things with you regarding this. Sometimes, by the way, these actually measure patients. And so when you bring them up in the air, you can push a button and it'll give you their weight, which is kind of cool for a bedbound patient. And you do something called tearing them before you do it. Did you do that in chemistry where you have like a scale and you put a beaker on it, but you dialed it back to zero because you don't want to know what the beaker weighs, you want the liquid inside. So you do that same process here. If you're going to have her on a sheet, then I'd weigh the sling with a sheet on it before I got started, before I put my patient on it. See how those legs are parallel? Well, that actually is not very stable. We would rather have what position? A tripod. And so most of these have a mechanism where you can tripod them, and that way they're less likely to tip when you get the patient up in the air. Because the worst case scenario is they move and they knock this puppy down with them in it, and they've got a whole big problem. This actually would go under the bed, and he and I would lower it down to the lowest position, and we'd hook these all up, and we'd press a button, and the person could come up. I could use it for changing the bed. I could use it for transferring them some way that I want to go. So it would be locking this, doing the side-to-side for the sling, and some of them have a hand crank. The older ones have an actual hand crank. I don't really care which brand the hospital has when we get there. It's going to be blue, it's going to be red, it's going to be this. I don't really care what this thing looks like. We're going to have to know how to operate it. So the first time we use it, we're not going to guess. We're going to go to an experienced nurse and say, I need to get my patient up. They told me to use the hydraulic lift, and I'm wondering if you can show me. Everyone next quarter should have the experience of trying to get somebody up with a hydraulic lift. So what I usually do is just go tell the nurse's aides, if you are getting somebody up or you're weighing them with the lift, can I come with you? Because I don't know how that actually works. Something that really bothers me that I've seen lately and I consider really unsafe, so I'm going to mention it to you, and that is that nurses' aides will put patients up on a sling like this, and then they want to make the bed without reaching under them, so they'll leave the patient out here suspended in the air. Okay. If that patient moves, and they do, and they will, and this thing is unstable, and they start falling, I think that's going to be a very hard thing to explain. So I actually never have them not over the bed. Worst case scenario is I lower it down, okay, and reposition them in the bed. But some of them are made to swing around, and that's what this one is. This one is made to move, all right, and swing around, because you could get them up. And there's another sling here that will bring them into a sitting position. So you roll them on their side, put the sling in, roll them back on the other side, pull the sling through, put them in this. And when you did this, it would bring it up in a sitting position, so you could unlock the bed, push it away, set the wheelchair there, and boom, you're lowering them down into the wheelchair. So that's the no lift that we're looking for. And there's a variety of different things. Some of them, just are for sitting. There's actually a back sling that would pull them up. That if they couldn't do that thing and where you and I had to do the arm thing, but that's not really good for Edward and I. So we could put a back sling thing under their arms and have them hold on and have them pull it up like that. See, all of these are nurse savers. They're only nurse savers if we actually use them, however. So, anyway, all right, let's take a breath for a second.